Frank was a very loving, easygoing fella. He was a great musician. He played the accordion. His friend bought him a shirt that said the Jimi Hendrix of accordions. And it was like part of his, he was an amazing player. He really was. Loved his family, was everything to him. Very loyal, very loving. Yeah, he was a blessing.
Actually, Christine is here. She is. She's the best. I love her to pieces. I look forward to when she comes. Nice smile.
To be a hospitality manager, helping others in ways that make them feel comfortable and making them feel like they are at home. It's difficult being in a hospital and let alone not feeling well. So to me, being that person for that patient is rewarding in its own way. You look good.
Yes.
You look good.
I feel much better than yesterday.
That's wonderful.
I think that the hospitality managers are an undeniable asset to the health system. It's just that little icing on the cake, the cherry on top. You know, we have great care teams, we have great employees. This is a way that we elevate every interaction with patients.
Day to day is just trying to spread as much sunshine as I can. As I come in the morning and I try to have that sunshine, I just try to give it to those who are willing to accept it.
Christine is very special. She really takes the time to get to know a person. She is intentional when she walks into a room with the focus of making that connection, spending the time listening. She just consistently does it every day.
So when I met Frank, we built a connection on our heritage.
Being Italian, she was Italian, and his favorite subject after his grandchildren, food. They were talking about cooking and food, and he was just thrilled. She was a doll, just a sweetheart, because she made you feel like you meant something. And he was thrilled. He was thrilled to meet her.
We got on the topic of St. Joseph's Day, and on St. Joseph's Day, you have a signature dish. It's pasta con la sarde, and it's Sicilian pasta with anchovies. I'm not a huge fan of it, but my parents go to the Bronx and Brooklyn every year just for that dish. Frank loves that dish, so we started talking about that and other Italian recipes. I had the idea, without him knowing, create a recipe box.
I'm sure that's why she decorated the box with all these stickers of Italy, Leaning Tower, and also had some pictures in there besides her family recipes that she shared with him.
Each one typed up all the Italian feel-good comfort recipes. And I wanted to gift that to him and his family and his wife and his son to enjoy, along with a bottle of olive oil and just a personalized card, having them enjoy it.
He unfortunately never got to make any of the recipes. He went to the hematologist, and the next day she called him, and she noticed he was jaundice. She said, your liver enzymes are off the chart, and that's when he went to the hospital. He had gallbladder cancer, stage 4, and we were ready, to have the treatment and all of that, but he never even had the port put in. He just declined. And then on July 12th, he passed of last year, 2024. I told him when he was very sick in the hospital, we had a good life. We were blessed, really, really grateful.
Hearing of loss hurts in no matter any situation that you're in. I didn't expect the reaction from that gift that I was giving to him. I, in my mind, thought it was just something small, that I was doing this for him and his family. The reaction when he received it was just, it was amazing.
I kept a lot of things of Frank's, and they mean a lot to me. Like I display them. This recipe box, I kept it out. I kept it out on my counter where people could see it because it meant so much to him and so much to me.
I believe Catholic health is really about preserving human dignity in the midst of suffering. They don't want to be known as the patient in bed 2. They don't want to be known as the breast cancer patient. Everyone is a person. So our hospitality team, their main focus is just rounding on patients, making connections, listening, and just really being seen and heard.
At the end of the day, it all comes back to our patients and our family members and just to be there for them.